Hi, I'm Dr. Keller. Thank you for your interest in veins. You know, people think that varicose veins are ugly and that's why you should get rid of them. That is true, and you know, Keller's a name, beauty's a game. But what I'm more interested in is the health or the abnormal health of varicose veins. Think about it. What is a vein? Vein is bringing blood back up to be cleaned. Remember that venous blood has a lot of toxins in it, and when it sits in those blood vessels and doesn't move around, those toxins leak out and can lead to a lot of complications, and we'll talk about that in just a minute. So I want you to think of varicose veins, spider veins, any vein you can see as not a healthy vein. Now, what can we do about it? Well, there's this revolutionary procedure called EVLT, and what that does is it lasers the veins closed. In the old days, we used to do vein stripping. And remember, vein stripping was a problem of threes. 3 days in the hospital, 3 weeks of recovery, and in 3 years, the veins came back. Now with this new procedure, EVLT, the veins are permanently gone. And it's about 96% effective, which is a huge number in medicine. We don't often get that good of results in medicine. But let me explain exactly why you have varicose veins. First of all, remember that your veins, if we take the top of the skin as here, and this is down deep in your legs, there's a vein down here called the femoral vein. And nature designed it to carry almost 98% of the blood back to the heart. Now remember, it's having to go uphill. So what keeps the blood from going back down? Well, these veins have one-way valves in them, okay? And these one-way valves keep the blood from dropping back down. But here's the problem with varicose veins. These valves, genetically speaking, if you have varicose veins, are missing a very important protein. So the valves become loose. And so what happens is the blood goes up, and it's kind of like an elevator rising up. As the blood goes up, it stops, and these veins, these valves, keep the veins and the blood from dropping back down. So it's kind of like we're moving these quantums of blood up. But when the valve is not patent, as we say, then the blood flows back downhill, and it keeps dropping down until finally it finds a good valve, and that's why you get that dilation. Okay? So what happens is that how much do we depend on these valves? Well, a lot, but not so much on the femoral. So look, the femoral vein is surrounded by big muscles, because the question is how does the blood get back up to the heart and the lungs and the kidneys? Is it a function of the heart? No. It's a function of the muscles squeezing. So when you move your legs, or even sometimes unconsciously, these muscles are contracting and they're squirting the blood back up. Okay? So we don't often have trouble with the femoral vein. But here's the problem. There is a communicator, it's another vein, that attaches to what's called the saphenous vein. And the saphenous vein is where the problems begin. Okay? Because the saphenous veins aren't surrounded by muscles so much. So they're very dependent on the valve to keep the blood moving forward. Well, here's the problem. When those valves become loose, the vein dilates, and that's why you see it. If it dilates enough, then it's got a little relief valve or vein that attaches to those blue and green veins that you see under your skin. Those are called reticular veins. And pretty soon they start to get big, and when these reticulars finally can't hold any more blood, it leaks out into those little spider veins that you see. So spider veins are really the tip of the iceberg. That's really the problem. Now, let me tell you a very disturbing statistic. Those little spider veins that you see around people's ankles, or maybe even you have them, there's a 2% mortality rate associated with those little veins. Why? Because they're under so much pressure that at night they pop, and they don't just ooze, they bleed a lot, and people have actually exsanguinated. So that's one of the reasons that you should have your veins taken care of. There's also some other reasons. Keep in mind the following. What kind of blood, we talked about this a little earlier, what kind of blood is venous blood? It's used blood. It's got a lot of toxins and poisons in it, okay? And so what happens is, if that blood is just sitting there and it's under a great hydrostatic pressure head, those toxins leak out. And so if you look at people that have had varicose veins for a long time, you'll see that the skin, especially in their ankles, begins to turn dark. What happens then is that skin breaks down and you end up with an ulcer. Now, the worst case scenario that happens is sometimes if that ulcer can't heal or goes into the bone, we end up with an amputation. And we don't want any of that. And there's no reason why that should occur anymore. So, what do we do now? How do we cure this? Well, it's really slick. We use a little laser called an EVLT, and it's very small, as you can see from here. So let me put this down for a minute and talk to you. So look at this. This is a little laser fiber. You can see how small it is. And this is what we put inside that saphenous vein. This does not hurt. Okay, you're awake. We put a little Novocaine by your knee, and then using an ultrasound we find that saphenous vein, and we take a little needle and put it in, and then we thread this up your vein. I know it sounds kind of yucky, but you can't feel it because you're a little medicated, you're relaxed, but this does not hurt. And then with this laser, when we turn it on, it literally melts that saphenous shut. And when that saphenous is shut, it forces the blood back where it belongs, and that's into the femoral vein. And all those little vessels and blood vessels that you see dry up. After the EVLT, if some of the veins are remaining downstream, as we say, we may have to inject them with a sclerosing agent, but it only has to be done maybe 1 to 3 times. But the important thing, and what I want to emphasize with you, is when we do this, it's very fast, it's painless, and when you go home, I want you to walk around that day. This is completely different. This is a quantum leap from when we used to have to do vein stripping. So here's what I want you to use as a takeaway. If you have varicose veins, please get them treated. This is not just about beauty, okay? And the other thing is that the insurance companies have finally realized this. So a lot of the insurance companies will now pay for this, and so now we have an opportunity to use our insurance. Again, the procedure is called EVLT. Thanks for listening. If you have any questions, please call me anytime. Good to see you. Bye-bye.